ANJITHA, yes.
Good evening, everyone. I'm here to present my study, Brighter Vision, Straighter Eyes, LASIK breakthrough in accommodative esotropia. So, refractive accommodative esotropia is characterized by an inward turning of the eye due to hyperopia, which is corrected by wearing glasses. The advent of refractive surgery, specifically LASIK, has introduced a new avenue for treating these patients by directly correcting the refractive error, thereby reducing or eliminating the associated esotropia. The use of LASIK in these patients offers a dual benefit, correcting the refractive error that necessitates the optical correction and potentially improving the ocular alignment, thereby addressing both functional and aesthetic concerns. And the concept of using LASIK to correct ocular alignment in patients with refractive accommodative esotropia is grounded in the principle that by eliminating or reducing the hyperopic refractive error, the excessive accommodative effort that leads to the esotropia is minimized or eliminated. And the aim of the study was to evaluate the efficacy of LASIK for correcting ocular alignment and refractive error in patients with refractive accommodative esotropia. Our study design was a retrospective interventional study. We included patients aged 18 to 27 years with refractive accommodative esotropia attending the outpatient department of ophthalmology in a tertiary care center, and our study duration was 8 months from January 2024 to August 2024, and we included 20 eyes from 10 patients. And we included patients aged more than 18 years with stable refraction for 1 to 2 years and a fully accommodative esotropia cases and partially accommodative esotropia with hypermetropia. And we excluded people with accommodative esotropia without hypermetropia, with high AC by A ratio, elevated intraocular pressure, and a pachymetry reading less than 495 microns and a K value greater than 48 diopter. And under all aseptic precautions, topical anesthetic is instilled, iris registration done, followed by docking to stabilize the eye, then creation of a LASIK flap using microkeratome, and the flap is generally lifted to expose the underlying corneal tissue, and this lifted the underlying corneal tissue, and the laser ablation is done using the excimer laser, and the corneal flap is carefully repositioned where it naturally adheres. And here you can see the LASIK is being performed using the Allegretto wavefront optimized laser, and the flap is created using a microkeratome, and the flap is raised and the irrigation of the bed using called balanced salt solution. And here, as stated in the previous slide, the procedure involves creating a thin flap in the cornea followed by using an excimer laser to reshape the underlying corneal tissue. And the results showed that out of 10 patients, 5 has simple hypermetropia in both eyes and the other 5 have compound hypermetropic astigmatism in both eyes. And here a very low p-value of 0.00016 indicates that the difference in the prism bar covertest measurements with and without glasses is statistically significant, suggesting that wearing glasses significantly improves the eye alignment in patients. And this demonstrates the effectiveness of glasses in managing accommodative esotropia either by completely correcting the misalignment or significantly reducing its severity. Now most patients had a preoperative best corrected visual acuity of 6 by 6 with a few exceptions showing lower values, and post surgery all patients regained a preoperative corrected visual acuity, and this suggests a successful surgical outcome of LASIK in restoring the optimal visual acuity without corrective lenses. And preoperatively 10 patients were diagnosed with esotropia with 50%, that is 5 patients having fully accommodative esotropia and 50% 5 patients having partially accommodative esotropia. And you can see here at the 1 month post-operative follow-up, the outcome showed that all patients with fully accommodative esotropia achieved orthotropia without spectacles, while the remaining 5 patients with partially accommodative esotropia, they still had a residual esotropia which needed surgery, and those patients with minimal deviation, they underwent strabismus surgery achieving 100% correction. And here, as you can see here, this patient had a fully accommodative esotropia, and the patient is orthotropic with spectacles, and the orthotropia immediately and you can see the orthotropia immediately after post LASIK, and orthotropia 1 month post LASIK. And coming to discussion, in our study we observed that the patients' age ranged from 18 to 27 years with a mean age of 21 years, and the distribution of the refractive errors among patients undergoing LASIK correction ranged from plus 1.5 diopter to plus 6 diopter, and these findings indicates that our study's observations are consistent with those reported in other studies. And here we evaluated the prism bar cover test measurements for esotropia in patients, comparing the degree of deviation with and without glasses that was statistically significant. And similarly, Singh et al. Observed comparable results in their study, further supporting the effectiveness of glasses in enhancing eye alignment in esotropia patients. Here, as you can see, this is a patient with a partially accommodative esotropia with a minimal deviation wearing glasses, and this is a 1 month. This is immediate post-op LASIK, and this is 1 month post LASIK. And here you can see there is a minimal deviation that is cosmetically insignificant, and the patient doesn't undergo any surgery for that. And we compared preoperative best corrected visual acuity with post-operative unaided visual acuity for both eyes. Following LASIK, the majority of patients achieved an unaided visual acuity of 6/6 in both eyes, indicating that the surgical procedure was highly effective in maintaining excellent visual acuity. And these findings are consistent with those reported by Hoyos et al. And we compared the correction of refractive accommodative esotropia in patients undergoing LASIK surgery by examining the preoperative and postoperative outcomes. That is 50%. 50% of the patients had fully accommodative esotropia, and 50%, 5 patients had partially accommodative esotropia. And 1 month after the surgery, 50%, 5 patients with fully accommodative esotropia achieved orthotropia without any spectacles, and while the other 50% with had to undergo minimal residual esotropia. So to conclude, LASIK is a safe and effective method for treating refractive error and achieving orthotropia in refractive accommodative esotropia, and for partially accommodative esotropia, it effectively eliminates the refractive component of deviation. Thank you.
So how long did you have a follow-up after the last?
Sir, immediately after LASIK, then first day, then after 1 month, we follow up the patient. Then up to 1 year, we follow up.
You had a 1 year follow-up for all your patients?
Yes, sir.
Okay, and they continued to maintain the refractive error also.
Orthotropia.
And emmetropia also.
Yes, sir.
Okay. Normally, in which age group do you expect refractive accommodative esotropia? Age group?
Sir, normally we can correct more than 12 years. We can correct hypermetropic by LASIK. But we in our patients, in our setting, we did more than 18 years of age, sir. 18 to 27 years.
So you waited for the refractive, the common rule of LASIK, no? You didn't consider. It was mainly for the refractive correction.
Yes,
you
sir.
did it, not for the, because if you consider esotropia, you could have taken it earlier, no? Okay.
Many of these patients are also hyperopic, no?
Yes, sir.
Yeah. So what the protocol for, like, you did not mention about gonioscopy and all that in your protocol for evaluating patients for LASIK?
Sir, we excluded patients with high intraocular pressure.
Yeah, but that still is not same as gonioscopy, no? Because many people can have concurrent angle closure as they increase in age. The relative pupillary block can increase and they can develop. So gonioscopy finding is very, very important, especially if you plan for a procedure like LASIK. We don't do it as a protocol, but these patients are different. They are not myopes.
Yes, sir.
Yeah.
Okay, thank you.
Thank you.